The tinnitus company Neosensory seems to be shutting down, and honestly, I'm not surprised. This news leaves many patients wondering what comes next, especially those who have been using the device as part of their tinnitus management routine. I'm Dr. Ben Thompson, audiologist and founder of Treble Health. We're a team of tinnitus specialists providing expert care nationwide through telehealth. Over the years, we've worked with thousands of individuals to help them manage their tinnitus using evidence-based methods. So when new devices enter the market, we pay attention because we know patients are looking for solutions beyond what's traditionally been offered. When Neosensory debuted their Duo product for tinnitus relief, we followed its progress and worked with patients who were trying it. Some individuals found it soothing, but overall, the results were mixed at best. For those who relied on the Duo, this shutdown leaves a lot of unanswered questions. What happens next? Was Neosensory ever a viable tinnitus treatment? And most importantly, if you still struggle with tinnitus, where do you go from here? So guys, I looked into this and the warning signs have been there for months. Neosensory's social media accounts have been inactive since October 2024, and their LinkedIn page has been quiet, with users even asking in the comments if their product is still available. Several key team members left the company in late 2024, including their chief product officer, chief revenue officer, and head of operations. The lead scientist on the project is no longer working at Neosensory as well. Even David Eagleman, the founder and CEO, has, to the best of my knowledge, been silent about Neosensory's status on all of his social media platforms. Financial data tells the same story. Reports from PitchBook and other sources show a slowdown in projected employee growth. Neosensory had previously partnered with Oak Tree Products to distribute their tinnitus product to audiologists, but the Duo is no longer available on Oak Tree's website. All signs here point to a company facing serious financial difficulties, trying to quietly shut down without making waves. Neosensory's website shared that they're shutting down operations and that the Neosensory app was offline as of February 15th, 2025 for the tinnitus users. They advised users to lock in their settings before the shutdown, with tinnitus users losing access entirely once the app stops functioning. The announcement expressed gratitude to their customers but did not provide further details on why the company is ceasing operations. On Reddit, users reacted with frustration and confusion. One user shared an email they received from Neosensory confirming the shutdown. So let's look into this a little further. Neosensory's tinnitus device was based on a method called bimodal stimulation, where two types of sensory input are paired together. In this case, the device used a wristband that delivered gentle vibrations to the skin while playing specific tones through a companion app. The concept was that by combining sound and touch, the brain could differentiate between external and internal sound and gradually learn to filter out the internal tinnitus sound effectively. Users were encouraged to wear the wristband device daily for about 10 minutes, listening to ascending and descending tones while receiving time-locked vibrations through the wristband. Some people reported that this helped them focus less on their tinnitus, while others did not notice a significant difference. In my opinion, one of the benefits seemed to be that the device encouraged a structured daily practice of relaxation and sound engagement. When my tinnitus patients are exploring new treatments, I know that they're looking for real, lasting relief. Neosensory's approach was innovative, but the effectiveness varied. In the cases that my team and I followed at Treble Health, around half of the users noted significant improvement in their tinnitus perception. For people who were using the device as their primary treatment modality, it was working about 50% of the time, and the other group reported no meaningful change. These results were lower than what we typically see with more established approaches like tinnitus retraining therapy, where over 80% of patients experience a significant reduction in tinnitus impact. This highlights an important lesson. While new technology can be exciting, it should be compared to the existing standard of care to understand its true potential. Neosensory published a research study in 2023 showing that many users reported improvement. However, the study had a small sample size, and larger, more rigorous trials would have been needed to confirm the long-term benefits. While the Neosensory device was available for purchase and marketed to tinnitus sufferers, it was not FDA approved as a medical treatment for tinnitus. Instead, it was sold as a wellness product, which allowed it to be offered directly to consumers via purchasing it on the internet. And also, some individuals could purchase this through an audiology clinic. But don't think that this device did nothing. I know firsthand, speaking to patients, that they swore it was a big part of their recovery and it provided them a lot of relief, especially when they were having a tinnitus spike. So some users found value in the experience of using the Neosensory wristband. However, my team's professional consensus was that it was not very effective and more research was needed to validate clinical benefit if there was any at all. One of my key takeaways from the Neosensory experience is the role of daily relaxation and nervous system regulation and how that can play a role in tinnitus management. Even though the device itself didn't meet our standards for tinnitus treatment, some users found that the structured daily practice helped them calm down and be more in control of their tinnitus symptoms. You see, tinnitus is deeply connected to the central nervous system. And if you've been following our YouTube channel, you know this. It often worsens in times of stress, anxiety, or poor sleep. And tinnitus seems to get better or less noticeable when your overall nervous system is regulated, healthy, you're exercising, you're getting good sleep. That can make a significant difference in how your tinnitus is perceived, i.e., how it impacts you and how much of a problem it is. Many established treatments like sound therapy and cognitive behavioral therapy approaches seek to calm the central nervous system and to help the brain reframe tinnitus as a neutral signal rather than a threat. So what should you do now? Well, people with tinnitus are often looking for an effective treatment, something new and exciting that will change everything overnight. That's understandable, especially when so many have been told that they just have to live with it or there's nothing you can do. But the truth is, there is an existing standard of care for tinnitus with a 30-year history of success. It's called tinnitus retraining therapy, and it combines sound therapy and structured counseling with a trained audiologist to help the brain gradually reduce its focus on tinnitus and the awareness of the sound. That process is called habituation. And if you speak with people like I do, who've graduated from our program at Treble Health, they will tell you they're so much better that if there was a tinnitus cure, they don't even need it. So that's the power of habituation. That's the power of using your brain's natural ability to reduce the sound over time. Tinnitus retraining therapy is one of the best methods to do that. For example, it has a success rate of over 80%, which is significantly better than what we saw with Neosensory. Also noting, many modern hearing aids can have built-in tinnitus relief programs, including sound therapy, which make them a strong option for those seeking relief. And especially if you already have hearing aids, you definitely want to get that set up. I'd love to hear from you. Did you ever try Neosensory's device? If so, what was your experience? Leave a comment here on YouTube and let me know your thoughts. And for anyone looking to take the next step, I recommend taking our free tinnitus quiz. It's an online assessment that helps identify the best treatment path based on your specific condition and what you need to get better. I'll include the link below, or you can tap the link on the screen right there. Thanks for watching, and I'll see you on a future video.